thank you everybody so much for coming today. We've got a great story to tell you this afternoon, and it's a story of a community that has really come together in a very caring way to bring forth a solution to one of the most difficult issues that cities across the country face, and that's the issue of homelessness, but in particular, the issue of the chronically homeless. And if you're in this room as an advocate, you know what that means. If you're not, and you haven't been involved in this program since the beginning, chronically homeless is the population of the homeless that are medically vulnerable. These are folks who have lived on the streets in many cases for decades. These are folks that are most likely to die on the streets of Albuquerque. And these are also individuals that not only suffer from the human standpoint, but who are also come at a very high cost, if you will, to the resources that we're trying to stretch in communities across the country, because if they don't have medical care and they have to spend nights in the emergency room, if they have to spend days in the hospital because of the fact that they're vulnerable and that they're living on the streets, that comes at it does come at a high cost. And that's why we call Albuquerque Heading Home the smart way to do the right thing. We know what the right thing is, and we think we're going about a very smart way of doing this. And I'll tell you a story. I believe we have a mayor from Kentucky coming in the next couple of weeks, maybe in the month, to talk to us about bringing this solution to their city, into Lexington, Kentucky. So we'll be talking to Mayor Gray, who's a friend of mine who I've met through the mayor's conferences and other things. And we've also done webinars now at this point with Robin and Dennis and everyone else, because people around the country, I think, are starting to look at this model and they're seeing how it's working here, and they want to take it to scale in their cities. So a couple of things to start off with, and then I'm going to turn it over to Dennis Plummer, who's going to walk you through a very interesting slideshow to give you some of the numbers. We just came on our second year anniversary for Albuquerque Heading Home. And if you remember, in February of 2011, we went out in the streets of Albuquerque during one of the coldest snaps that we've had in the history of Albuquerque, actually. And it was an absolute miracle that we didn't lose anyone on the streets during that cold snap, because it was absolutely brutal. And you've seen some of the documentary footage. We've been where we went out, and hundreds of volunteers from around the city went out and did a survey, and we interviewed the folks that are homeless in our community. Well, late January of this year, we just went through our second survey. So we reached our 2-year mark, and we went back out in the streets of Albuquerque with the Coast team, and Chief Schultz, thank you so much. Jody Jepson's here, and everybody from that team who went out with us again. Thanks to Dennis Plummer and everybody from the Homelessness Project and all the volunteers. We had parents with their kids, we had grandparents, we had people from the business community, we had an enormous variety of people in our city that went out and helped us do this survey. So a couple of things I'm going to talk about, and then I'm going to turn it over to Dennis. The good news is this: when we started this program the first year, we set a goal of housing 75 people, and we met that goal. On our second year, we set a goal of housing 166 people by February of this year, and I can announce to you today that we have 171 people now living in housing in Albuquerque. So that's a great story of promises made and promises kept. And we're going to meet here in the near future and talk about our goals for the third year for Albuquerque Heading Home. What's interesting is you look at these numbers, you're going to see a lot of numbers today, but there's a couple of things that really jumped out to me as a mayor when I went through these numbers, and Dennis and I talked about the impacts. You're going to see from these slides that 2 years later, after we started Albuquerque Heading Home, we found 454 less homeless on the streets for our second survey as we did with our first survey. Of those that we did find on the streets, those individuals had much less propensity to be vulnerable than the individuals that we interviewed the first year. In 2011, when we did the survey of the vulnerable, the average time on the streets was 20 years. This year, the average time was 6.5 years. That's a 13-year drop in the population of vulnerable homeless in our community, and that's an amazing statistic. It also tells us that actually Albuquerque Heading Home is working, because that's what this program is about. This is about getting the chronically homeless off the streets. And if we've been able to drop the time that folks have been on the streets that much in 2 years, we know that those 171 people that we've been able to put into housing came from the right category. So all of these things are part of a metrics that allows us to know that we are doing the right thing, and we're doing it the smart way. We also found 22% less veterans this year on the streets than we found in 2011, and that's an amazing thing. We also found a 15% drop in the number of individuals. So first of all, we have a smaller number of individuals, and of those individuals, we have a 15% drop in the number of people who've had to spend 3 times or more being hospitalized in the city of Albuquerque. So that's the cost saving side of the equation as well. So it's amazing, and I'm going to let Dennis take this over at this point. I do want to thank some folks before we get going. I know that Chuck Sheldon is going to be talking to us a little bit, and I know that Kelly Sinier is here from the Apartment Association of New Mexico. You guys have been absolutely great partners with us. Once again, Chief Schultz, thanks to APD and your department. And really, this is just it's an awesome deal, because you're going to see slides that show almost every category of disability has gone down on the people that we surveyed this year. You're going to see other charts that show ER visits, HIV/AIDS, liver disease, cold weather injuries, percent vulnerable, percent that are trimorbid from a vulnerability standpoint. All the numbers are in red, and that's what we like to see. So with that, I want to say thank you very much. I'm looking forward to the presentation. And with that, I'll bring up Dennis Plummer. Dennis, you're a great advocate.
Thank you all for being here. My name is Dennis Plummer with Metropolitan Homelessness Project. And the space that you're currently sitting in is our kind of headquarters for Albuquerque Heading Home. So this is a communal think tank space. There are conference rooms, Yahtzee, Jenga, all the things that are essential for brainstorming. And as we're launching into now starting our 3rd year, we began in 2011, so we finished 2 years. I'm very excited today to show to you what is our new logo and our new image. We kind of think that heading home is the key to ending homelessness, and if you'll notice there in the horizon, it is definitely distinctly Albuquerque. And we look forward to, with a new polish on our image, to be moving on in this effort. I just want to briefly tell you what we did. So those of you that aren't familiar, in Survey Week, what we did was we attempted to survey everyone who was out in the streets, at the shelters, under bridges, wherever we could find them, and we gave them an option to complete what's called a vulnerability index. On Thursday through Sunday, the week prior, we did training of all of our volunteers so that everyone was administering the survey in the same direction, same manner. Monday through Friday, all throughout the day, evening, morning, we were going to all of the sites where we know people reside. And specifically, Tuesday and Wednesday morning, from 4 a.m. to 6 a.m., we went out to look wherever we could, finding people as they woke up. In those mornings, we had teams with 3 or more members, and we divided Albuquerque into sectors. We actually mapped out in 2011 all the places where we know people predominantly stay. And we covered those sectors on 2 consecutive mornings, asking everyone we encountered to participate in our survey. I just want to point out that this is the same methodology as was used in 2011. So we're using apples to apples as we work through this. The vulnerability index itself measures all of the indicators that you see up here. This is actually formed out of Boston, Dr. Jim O'Connell, and is endorsed nationally by Healthcare for the Homeless as a way to measure end-of-life risk factors. And so when we interview people, age, time on the street, number of times in the hospital, plus these indicators here, go into an algorithm in the computer, and that spits out a vulnerability rating. Nationally, we are seeing that homelessness has stayed about the same. We do see an increase in families and youth, in particular, those populations. We are seeing, however, a decrease in veterans and people who experience chronic homelessness. That's nationally, and you'll see that that is mirrored locally as well. And we know that there is, in 2010, a document called Opening Doors that was released by the Interagency Council on Homelessness, where people were specifically focusing on chronic homelessness and veterans, and then subsequent other methods of homelessness as well. And as we focus on these populations, we can see that we are able to make a difference. Locally, now we get into our numbers, and this is where it gets interesting and encouraging. As the mayor said, You can see a reduction in sheltered, unsheltered. Now these are preliminary numbers of our point in time count that is still being finalized and submitted to HUD. But initially what we are seeing is a significant reduction. This that's down here in the bottom, I wanted to see what exactly happened on the mornings of our survey. In 2011, we found 32.5% of all the people who self-reported they'd been homeless on that night. So what happens is we find a certain number of people on the street. Then throughout the week we say, where did you stay Monday night? And people may self-report, I was on the street. And we say, well, how well did we do in connecting with you at that point? In 2011, we connected with 126 people on the street in the morning, and 387 had said that they had been on the street. So about a 32.5% success rate of discovery. In 2013, we did slightly better. By 0.8%, we found 48 of those who reported of 144 being on the street. So now we're doing the survey with all of those people that we find, and we're asking them all those questions that we just reviewed. 420 agreed to do the survey, and of those, 48% have shown up as being medically vulnerable. We're not going to go through every line item, just in case you had a panic moment there. But what's interesting here in particular, again, is at the top, these are the numbers surveyed and those that are percent are vulnerable, comparing 2011 and 2013. I also wanted to have us have some context, not just Albuquerque in a bubble, but Albuquerque within the national trending. So I'll let you look at those, but what the mayor pointed out, which to me is a validation that we're headed in the right direction, is on the far right, all of the red numbers. Initially, when we saw that there were that many less people we were finding on the street, there was some concern of our methodology is off, is something missing, and we know that it is always an under-report. There are people in motels doubled up in cars, people that don't report, people we don't find, so we know that that's true. However, across every indicator, we're seeing a downward trend. In particular here, the one that the mayor pointed out, those who had been hospitalized inpatient 3 or more times in the last year dropped by 15%. Veterans dropped by 22%. And again, if we're focusing, I was talking to the mayor earlier, I said, you know, it's interesting, we focus nationally on overall homelessness, but in particular, we've highlighted veterans and those experiencing homelessness in a chronic fashion. And we're seeing those are the two areas where we're seeing national reduction. When we focus a concerted effort on a population, I think we see results. So now we move on to families, we move on to homelessness in general. I think these are incredibly encouraging statistics and numbers. These are, again, more of the conditions that we're assessing. This one kind of shocked me, and I ran it more than once to make sure that we hadn't miscalculated, but the length of time on the street of being homeless, as the mayor said, if we focused on the most chronically homeless, and we've housed 171 of them, we should start seeing an impact. The number of people who have been out there longer would become less and less. Eventually, my vision would be to see we're working in real-time response. Somebody homeless today, we get them into housing tonight. That we keep reducing that length of time of somebody having to be out on the street. These were our goals: 75, 90, which is 170, 65. Got to do my math. Obviously, we've exceeded that at 171. If you look at the bottom line, an additional 16 family members have been housed too. So when we're reporting to you numbers, we are staying in fidelity to our motto, which is chronically homeless, medically vulnerable. That's the individual. But there's a family attached oftentimes and connected with that person. And so we're actually having housed over 180 people now who had been living on the streets. Our retention rate, and this is after 1 year of housing, is 87%, which exceeds our goal. Our initial goal was 70% or higher. We've seen consistently a higher success rate there. If you return to our vision, homelessness is rare. We're housing a lot of people. It's short-lived, the time that they're on the street to when they get housing, and that it's non-recurring. So this number gets to the non-recurring. Are they able to maintain, and are we able to support people in housing beyond just the 1 night, 1 week? We're looking at 1 year plus. So where is all this happening? How is it all happening? This is where it gets even more interesting and exciting. We have so many volunteers who make this work. And you may have heard of a home team. Home teams are community volunteers trained to support somebody recently housed. So teams of 4 or 5 individuals will connect with somebody that we've housed. And throughout the year, as they're needed to drive to the grocery, help with a home budget, be there for support by a telephone call. This we really have seen nationally in other models and have adapted it locally to meet Albuquerque's need, keeps people into housing in their homes. We have move-ins, a wide network of people every week that are picking up donated furniture and every week moving people in. Because you imagine as we've housed somebody, it's an empty apartment until the generosity of the community kicks in and the volunteers deliver the bed, the table, and the chairs. During survey week, we had over 150 volunteers active. On a day-to-day, we have anywhere from 40 to 50 that we can tap depending on what the need is. And that's growing. And counting all of you in here to sign up on your way out if you haven't already. The people that we've housed, this is inspiring. So not only do we take someone who's been chronically homeless and help them attain their housing of their choice, but they start giving back. So we can talk about cost savings, but I also want to talk about welcoming people back into the community, welcoming them back as a neighbor. We have one person who's recently housed is now the team lead of one of those home teams that I mentioned. We have a couple that are on outreach with Jody and the Coast team looking for other vulnerable people on the streets. We have one who's assessing all of the thrift stores in Albuquerque and rating them on their costs and what they specialize in, how many bus stops it takes to get to those. We have a couple who come here and help us in our office work. It's incredibly inspiring to be around people who have lived a lot harder life than I've experienced and who just immediately turn around and say, what can we do, Dennis? How do we get involved and how do we give back? 2 of those people, and I just want to use these brief stories to illustrate both the smart way and the right thing. A gentleman we'll call L, he was a war veteran since 1998 and disabled. He'd been homeless for 14 years on his disabled condition, but not connected to his disability benefits. If you can imagine trying to find all of your paperwork while living on the street and maneuvering the system that you and I probably find quite challenging to begin with, being homeless is one of those additional obstacles. He was housed for a year, and during that time, we connected him to specialists, and we have team specialists who connect people to their disability benefits. When he was finally connected with the VA said, you know what, we owe you $44,000. He'd been living on the street homeless and had been eligible as a disabled veteran for $44,000 of benefits that he himself alone had not been able to connect to. But through Albuquerque Heading Home, we were able to connect him to that. R is, again, a story that's moving for a lot of my staff because we get very close to these people. He died about 3 weeks ago. He had been in housing for 9 months, a little more than 9 months. And during that time, he'd been estranged from his family 14, 15, 16 years. Staff convinced him to let us start looking for his family on Facebook. And staff were successful in locating his family members. The children arrived about 2 weeks before he died and were reunited with Dad. Mom and Dad arrived about 3 days before he died. And Mom said, you know, we were here a year ago driving in the streets of Albuquerque looking for him. And we weren't able to do that. And some of our staff, after he passed, took her to see his apartment, and she said, I was so afraid I would have to die with the memory of him dying under a dumpster. And she said, you know, this is amazing to see what a community can do to bring in enough support to give my son some dignity in his last year. So it's so much more than housing, people. You know, it's housing and it's friendship, it's community. To me, the right thing. I just realized we call him R. Maybe he's the right thing. We do it through a couple of other ways. We help people stay housed. Peer-to-peer, those people we've housed, we just had our luncheon yesterday, Monday. It's been a long week. Monday, whenever Monday was. We had 17 of the people we've housed so far come together. They share success and stories, encouragement, challenges. And we have an amazing care team. And I use this picture. It's not even the entire care team, but it represents Healthcare for the Homeless, St. Martin's Hospitality Center, APD, an ACT team, an independent housing specialist, Metropolitan Homelessness Project. Albuquerque Heading Home, although we're often the face of it as Metropolitan Homelessness Project, is a citywide initiative on all levels. And it's continuing to challenge and push our ability to change our system and the way that we address housing and homelessness. We have so far to go beyond just the individuals that we've housed, really breaking down our own barriers that we've set up as a system. This represents some of that amazing collaboration. Part of the collaboration is that government can't do this all alone. It's government, it's private, it's so many different facets. And one of the amazing facets that I'm excited to announce today is a partnership that the mayor alluded to with the Apartment Association of New Mexico. I'm still looking around, Chuck. I think you may, and this partnership may be unique in its model. If so, we're going to be challenging our nationwide partners. This is about home to home is what we call it, home to home, taking dollars in the housing industry and moving it to help house somebody who's not been housed. And so without giving away any of the thunder, I'll just invite Chuck up here, who's the president of the Apartment Association of New Mexico. Please welcome Chuck.
You know, there's always touching stories, and as we kind of walk through this, you know, personally, we've assisted 8 families, 8 individuals come in off the street. And then we have also got into assisting high school students that are living on the street through another program. And the caretakers of these programs, you know, are responsible. And so you need to work hand in hand with the client, with the caretaker, with the property owner, so you provide quality housing for folks. And we really endeavor to do that. You know, with that, what I'm looking at is that we've, and through Kelly, and Kelly has really been the spear in putting this together. And what we're doing when we say home to home is we're going to be kicking out a new program that deals with where tenants can contribute from as little as $1 to, you know, multiples, and we add that to the rent, and it's voluntary. That will be collected from each of the tenants that pays their rent and contributed right back to this program without any overhead. That's huge. You know, usually everybody has their hand in the till. So, you know, it's you know, we're trying to figure out how to really be effective in reaching out and helping this program. So we're introducing this, and this will be coming out in our March and April issue. And it has forms on here that where people can sign up, the amount they're going to have, so that's collected. And on at the individual property level, so somebody will collect the rent. We have an organization that we have, TNC Management. We have around 1,200 units, and people mail in their rent. And so if we have one of these things set aside with them, they can then contribute that extra dollar, and we have that identified. So a little more bookkeeping, but we can get the accounting done and where we can contribute that. About a third of all people in Albuquerque live in rental units. So if we can reach those folks, and everybody is owners, managers, talk to your owners, go forward with enthusiasm to help convince that this is a thing to do, that we're able then to generate a lot of money that would come in. That one of the goals of right now is about $32,500, right? That serves 5 people. Thank you. So if we look at being able to do that, we may be able to do much better than that. And that would be my objective. And I think if everybody contributes a little, then we can do a lot. And that's the goal that we have here. You know, without taking any more time, Dennis, but I wanted to share that with you. From the Apartment Association, we're going to be having our monthly lunch tomorrow on the 14th. It happens to be my birthday, so I'm thinking about the day. And we'll be talking to folks about that then, and then this will come out in our issue. Thanks for sharing with me.
Chuck, thank you so much, and thanks to all the partners at the Apartment Association of New Mexico. Thanks everybody for coming today. For the media, I know there's individuals that'll be happy to do one-on-one interviews if you'd like to do that. And before we close today, I want to thank someone very special, and her name is Robin Otten, and Robin is sitting, where's Robin? Robin's right back there, and I want to thank Doug Chaplin. Doug's here. Anybody, who else is here from Family and Community Services? And if you're from, Heidi, good to see you. If you're from Family and Community Services, I'd like you to stand up, all of you. Robin, please. That's where the hard work's going on. Dennis and his group, but at the city of Albuquerque, we've got some true believers in this process. And Heidi, from the very beginning, we've talked about this. Robin, Doug, I just want to thank you all three personally as a mayor and as a guy that lives in the city for your passion for this, for the fact that you've been able to go down and break down those barriers and break down those hurdles that were there, and working alongside of Dennis and the Metropolitan Homelessness Project and just everybody else that's been involved. But I just want to say thank you to each of you three individually.